Hello, everyone. I hope you're doing good. My name is David Mwanza, a psychotherapist with Thrive Wellness Hub. So, I have been on the show quite recently, and I've been privileged to be here again to share more content with you. So, for today, I'd like us to talk about what is suicide? What is suicidal ideation? We'll get into that. And what are the benefits of therapy? Okay. But of course, before we get into that, let's talk about mental health again. I gave a definition as I was on the show last week, or was it 2 weeks ago, that our mental health is a state of awareness. All right. And a state of awareness where we know our limitations and we know our strengths at the same time, and that we are also able to function correctly and go about our day-to-day activities normally. All right. So in a case scenario where these things are not in place, you don't understand your strengths, you don't understand your weaknesses, and maybe you're dysfunctional, maybe be it with going to work, be it in your family or friendship relationships, intimate relationships. If these things are if these things have challenges for you, then there's a question mark or a red flag there that maybe you have to take a look at what your mental health state is like. All right. So just a brief definition to kind of jog our memories again. All right. So let's get into what I'd planned to share with you today. Suicide, right? We've heard about it. We've seen it, be it in the movies, and social media has brought to light a lot of challenges we faced regarding suicide, right? I know a story that was trending for a while about these, was it two nurse college students that I really don't know the context in which everything happened, but they took their lives. So this is a conversation we need to have, and we need to be aware of that these things are happening within our society, because people are facing challenges that they feel the best solution is to take their lives. All right. So that is what suicide is around. Suicide is basically the attempt or the act of taking your life. All right. Be it with jumping in front of a car, taking medicine, overdosing on drugs, whatever it may be. All right. So in mental health, we call the idea of wanting to commit suicide, we call it suicidal ideation, the thought of suicide, taking one's life. And when it comes to therapy and mental health, we address these issues, if someone has a problem like this, with four questions. All right. The first will be, do you have thoughts about wanting to kill yourself? All right. The other one is, do you have a plan on how you would kill yourself? The third is, do you have access to that plan? And the fourth would be, do you have previous attempts? All right, previous attempts of trying to commit suicide. So these four assess questions help us understand the level of risk. Because in a case scenario where there are two people and one says, yes, I have thoughts, I don't have a plan, I don't have access, and I've never tried it before, compared to another individual who says, I have a plan, I have thoughts, I have access, and I've tried it before. So these are different levels of risk. They both have thoughts about wanting to commit suicide, yes, but their level of risk is completely different. So these questions help us understand where exactly someone is falling, and helps us know how to move forward in as far as treatment is concerned. First and foremost, I'd like to state this. Having thoughts about wanting to kill yourself is a normal thing. All right? It doesn't mean that you are the only one who's ever thought like that. It doesn't mean that there's something wrong with you. Because sometimes the challenges we face in life make us feel like they are hopeless situations, make us feel like really there is no solution to this thing. But I mentioned a lot in our last interview is that as people, we are social beings. We need one another. So I may have gone through something that maybe you yourself are going through right now. But if we don't talk about it, if we don't share our ideas, our experiences, you would never have any clue that there are actually solutions around what you're going through. So having a social network is extremely important. I'll touch on these a bit as we go further on in the discussion. So those are the four questions that we look at. Do you have thoughts? Do you have a plan? Do you have access to that plan? and do you have previous attempts? When it comes to suicidal cases, these are very, very sensitive cases. And in therapy, the safety of our clients, the safety of an individual is our number one priority. It goes beyond meeting up for session. It goes beyond booking for session. If in any case scenario, there is suicidal ideation, there is thought of risk around safety, be it individual or someone that you know, then we have to ensure that these things are dealt with. Even as far as our confidentiality, what is confidentiality? Basically saying what we talk about here stays between the two of us. And it is upheld in the ethics as far as therapy is concerned. So in a case scenario where a client has these thoughts, then it is our responsibility as therapists to get the necessary parties involved to ensure the safety of this individual, of this client. Okay, that's a bit of education around therapy for all of you out there that are thinking of it or have had it before. So, as I said, it is our number one priority to keep our clients safe, to keep patients safe. Because, I mean, if a client dies or kills themselves, how are we going to help them at that point? We can't, right? So we need to keep them alive, keep them safe, that they can understand that there are still solutions we can plan on and make towards whatever problems they may be facing. So don't give up. Reach out. Help is there. All right. So that's a bit about suicidal ideation, some of the assessed questions that we ask, and ensuring that the safety of a client is our number one priority. So in relation to therapy, how does this work? So when it comes to therapy, and this is how we're going into now the benefits of therapy, be it with suicidal ideation, there's also homicidal ideation, where the thought of wanting to kill someone else. There's also interpersonal violence, where maybe it's domestic violence or GBV. These are all fall under the bracket of safety related questions, where we want to ensure our client is safe. And there is therapy for all these kinds of scenarios. So as far as suicidal ideation is concerned, homicidal ideation, interpersonal violence, anxiety, depression, substance use, and all these other mental health problems, how does therapy benefit this? Okay, so therapy provides an arena, it provides a space to talk, it provides a space to relieve tension, because pain of the heart is completely different from pain from the body, right? We can be able to see a scar, a wound on our body and treat it. But things of the heart and the mind are not the same. We can't really see the pain. We can't really see the injuries, but we need to heal them. They need to heal, right? So talk therapy is a treatment approach that helps with healing the inside pains, the pains of the heart, the pains of the mind. And how we do this is through talk therapy. Okay, so talk therapy is a strategy, psychotherapy is a strategy, a treatment approach used as far as suicidal ideation is concerned. It provides an arena to talk. I like to give an illustration of a balloon. So just like human beings, when we hold on to issues that are hurting us, issues that we are struggling with, it's like blowing hot air into a balloon. And the more air you blow into the balloon, what happens? It's becoming bigger and bigger and bigger, right? But what will eventually happen to that balloon? Yes, it will pop. And that is sometimes what happens to us. We are holding on to so much tension, holding on to so many things, and we are blowing up, and they reach a point where, we reach our boiling point, and boom, we have more problems. It comes into psychosis or any other mental health issue, depression, anxiety. We try and cope with abusing substances, be it alcohol or drugs. And so it's very important that we relieve this tension within ourselves. And talking is one of the best outlets to do that. And that's why it's very important to talk about these issues. And that's what therapy provides, an arena to talk. Beyond that, of course, we need to talk, but then what else? What else does therapy help us with? The other benefit of therapy is that it's a place of empowerment. We empower clients, we empower ourselves with skills skills that will help us address the problems that we are going through. Okay, so we don't want an issue where whenever we have a challenge we're facing, we need to call a therapist. We need to call someone for to find a solution. It's good to a certain extent, but the goal of therapy is that you grow towards independence. You grow towards strength where you're at a point. Remember what mental health is about: knowing your strengths, knowing your weaknesses, and being able to function, going about your day-to-day activities. So that's what therapy wants to get you to. And so it's a place of empowering, so that when you talk, when you get these skills that you use, you go out back into your daily routine. And as you face challenges, you use the skills that you've learned from therapy to address these problems and to overcome or to manage whatever stress or issues or problems you may be facing. All right, great. Apart from that, therapy is a place of support. So therapy is not only one-on-one. It can be in a group setting, maybe with people with related problems. Maybe we're a group of 5 or 10 going through depression, going through substance use. I'm sure a group called Alcohol Anonymous, you are familiar with it. And that's group therapy, where people come together, provide support for one another, provide ideas, share experiences, and they go back into the world and they do their best to triumph. They do their best to thrive. Where they succeed, we celebrate. Where they fail, we work together to find more solutions towards that problem and how we can do things better. Remember, we are social beings. We need one another. What one person has gone through maybe can be the support that someone else who is just going through that needs, right? Awesome. So those are a bit of the benefits of therapy. And beyond therapy, of course, it's not just one treatment that helps with mental health related problems. But as I shared last week, there are 3 others that I can touch on. And these would be support groups. I've touched a bit on that. And that what else would be there is social networks, your family, your friends, even work colleagues. They count if they are your friends, or maybe they're just for work. I don't know. But work and family, social networks are extremely important in life. Remember, we are social beings. We need to, I know COVID hit us hard and we were isolating and we were indoors, but things are opening up bit by bit. So maximize the people around you. Maximize if it's mentors, if it's friends, if it's colleagues who you can talk to, share issues with, get inspired by, so that we can navigate life together. We are social beings. We need one another. And the last one, and the most important one, I believe and I love to share about, is self-care. What are you doing for yourself? Because self-care is centered around meaningful, purposeful things and activities that we do that bring us life, that give us purpose, that give us meaning. Okay? And so what self-care would be for me isn't the same as what self-care would be like for someone else. So what's important to me, as I shared: football, music, going out to dance, going out to eat. Those are very important things to me. So what's important to me may not be as important to you. So you need to identify what works best for you and ensure that you integrate these things into your weekly program, even possible into your daily routine. Okay? So if it's exercise, please do a lot of exercise. If it's reading, do that. If you need to take a shower, please take a shower. Look clean, smell nice, interact with friends, help someone out there on the street. There are so many things that we know bring meaning and fulfillment to ourselves that we must ensure we do as much as we can. I know we get carried away with trying to help others and trying to look at the needs of others, but we have to look at our own personal needs as well, right? How can we pour into others when we ourselves have not been poured into? I mean, if it's praying is something that's very important to me. The Bible talks about pray without ceasing. The Bible talks about, if you are anxious, do not be anxious, but with prayer and supplication, with thanksgiving, let your requests be made known unto God. And so many other things, whatever it may be that's important to you, please practice these things. And this is one way of fighting and working and managing our mental health, okay? So that's what I had to share with you today. We talked about suicide. We talked about suicidal ideation. I touched a bit on homicidal ideation and interpersonal violence. And we also looked at what the benefits around therapy are. Okay? that it's a place of, it's an arena to provide a place that we can talk and put our issues down on the table. It's a place that we are empowered with skills, that when we are empowered with these things, we can go out into our lives, into our daily programs, into our community, and we can be strengthened. We can navigate and manage some of the stresses or problems or issues that we go through. It's a place of support beyond just face-to-face, one-on-one therapy. There's group therapy where people with similar problems, similar issues come together and help each other and support one another and share ideas on how to navigate their problems. And the last one, of course, not to name it last, self-care, taking care of ourselves. What we can do to do meaningful, purposeful activities that will strengthen us, that will encourage us, that will give us fulfillment in this life. Because there's more to life than just work, right? There's more to life than just making money. It's a very important thing. There's ourselves, our mental health, our physical health as well, our family, our faith, whatever it may be. There are important things in life that need to be addressed and need to be managed well. And if they are not managed well, we'll face a lot of stress and a lot of challenges. Okay, so that is what I had to share with you today. Please share your comments, ask questions, or maybe what other things you would like us to talk about that are important to you. And please reach out to Mellow Media, as we'll be able to provide that content for you. So thank you very much for listening, and we will talk soon. Take care.